live.
Oh, I pushed the button and we're live. And that's fun. So, welcome back, and I'm Dr. Kyle with Simply Health Chiropractic.
I'm Dr. Aaron at Simply Health Chiropractic here in St. George, Utah.
Yep, St. George, Utah. And we promised we'd talk a little bit about low back pain and chiropractic. And so we have some interesting things for you because a lot of people experience low back pain. And that's a very common theme of pain in our society these days.
It is, and I'm trying to navigate here, and I'm having...
So, wow. So what is low back pain? Well, there's a lot of variances of low back pain, but basically anything in the low back that is painful, even radiating down the sides, can be some definitions of low back pain.
I know a lot of the ones that we hear is sciatic.
Mm-hmm.
People come in, my sciatic is killing me.
Or hip.
Hip.
Yep, and basically my low back.
Right.
So we see that a lot around those areas. So what are some of the symptoms of low back pain?
Well, some of it can be no pain at all, but tingling and numbness into the legs.
Okay.
Pain in the hip, which we already talked about.
Right.
Pain in the anterior leg too.
Mm-hmm.
I don't know, there's a lot of them.
Yeah, and a lot of times we hear about pain not just in the low back itself, right?
Right.
And people even say hip when they're talking about low back.
Right.
And yet they're saying, oh, my hips hurt, and they're across the top. But we hear that one a lot. So it doesn't really matter where it is, but it actually affects quite a few people in the United States.
Saw some, oh man, next to the common cold, low back pain is one of the most common reasons why people visit their primary care physician.
Yeah. So it's like the second reason why people visit their primary care physician, next to
Common cold.
right. Well, we'll say cold-like symptoms, flu-like symptoms. Maybe, I don't know.
Yeah.
Anyway, so it is very common, and if I remember right, it is like 80% of all adults will experience low back pain sometime in their life.
Right.
So
if you haven't yet, you probably will.
yeah, and if you're not, lucky for you. But
Right.
I myself am a hero of low back pain.
A hero.
A survivor.
A survivor.
A survivor of low back pain.
And you survived.
Yeah. So even in my own story, I broke my spine when I was 17, and it was low back pain for years and years, and a lot of that was attacked. So the low back pain was attacked for symptoms and other things, medications and physical therapy, which all had their place.
Right.
And all did their job they were supposed to, but it wasn't lasting.
Right.
And so it wasn't until I visited a chiropractor that I got some results. And when I went to chiropractic school, I figured out what was going on.
Right.
Because sometimes low back pain has nothing to do with the back
Or the low back.
or the low back.
To be more precise, it
Right.
could do with the neck.
Yeah, it could be a neck problem. It could be a knee problem. It could be. But here we're going to discuss a little bit of what is the connection between low back pain and your neck.
Right. So, one of the things I like is when people come in and they're having, because low back's probably one of the most common we see people for next to headaches and migraines, is that you're checking them and yeah, they have pain in their low back.
Right.
But going through all the tests that we do, it's amazing. I had a guy come in. It was he was having a low back issue, but it was a top neck bone problem.
Right.
I'm like, give me some time, let's get some x-rays and go through the process. And I kept asking him because I'm just like, just curious. I got his pain scale when he first came in, remembered that number. When we went to go when we made that first adjustment, after we made it, I'm like, so how's the low back pain if you had to rate it right now? And it had decreased after resting him, which we do after all neck adjustments. It decreased a little bit again. And then when we came back in, it was down to a 2. I can't remember what the top number was, but I remember it was down in a 2. It was probably 6 or 7 when he first came in. And I said to him, like, that's pretty amazing, right? I haven't even touched your low back pain.
Yeah.
And it's down to a 2.
Yeah, so how does low back pain even connect to the neck. I mean, how is that even possible?
I think a lot of people think that the low back in that area is more, the feet would be the foundation of the body, the head's the foundation of the body, but really the foundation for the spine and the spinal cord is that top neck bone area.
Yeah, and we've talked about that before, how the neck, of course, houses the top 2 up to top 4 neck bones, house the brain stem.
Right.
And in there it is a group of nerves called the tectospinal tract that run all the way down the spine. And they control
Postural movements.
Yeah, postural movements and postural muscles, how they react.
Mm-hmm.
So you're walking out and you slip on ice and you steady yourself. Well, thank you, tectospinal tract. Yes.
We don't step on ice too much down here, though.
No, maybe a wet floor.
Maybe a wet floor.
But something to that effect where you slip and your body's able to stabilize yourself.
Right.
That is in function of what's happening, that communication between those muscles and your brain and what's happened. So it is really exciting to know that your body can communicate like that.
Right.
And so if there's a neck problem, right, the body compensates all the way down the spine with those postural muscles.
Right.
And we say compensate, it really does. The posture can show that it has changed.
Next time you're in the supermarket, just look how people are walking. How some of the big things is shoulder. We call it shoulder unleveling, but someone having a high shoulder. Mm-hmm. Or hunch forward and all these things, because the body's smart.
Yep.
It wants to avoid pain.
Yep.
And if it does what it can to avoid that pain, and most of the time we can see it in posture.
Right.
Especially with the riding reflex, where we want our eyes parallel to the horizon.
Right.
And so our body's going to compensate however it can. And it could be a mid-back issue. It could be what we're talking about today, a low back issue.
I like how you said that the body is intelligent. It has an intelligence to correct what's happening. It can adapt to get out of pain as quickly as possible. Mm-hmm. And sometimes it can do that, right? And your brain doesn't even know it did that.
Right.
Because when we make a correction, all the postural muscles start working properly, right? And now the client is working and moving tons better. Maybe it doesn't feel awesome sometimes. Right. Many times it does. Mm-hmm. But then the body starts working the way it's supposed to.
Right.
And we get a lot of misconceptions about back pain, don't we, in the office? Things that people think that back pain means this or back pain means that. Mm-hmm. So what's our first misconception about low back pain?
I would say the sciatic one we brought up earlier.
Okay.
They're in pain because their sciatic is on fire.
Right.
But we know sciatic pain is, the sciatic nerve doesn't sense pain.
And there's actually a couple other things that can mimic sciatic pain, right? Like piriformis nerve can do that if it's being impinged upon. Muscles, bursitis. There's all sorts of things. There's actually, I think, about 12 different things that can mimic sciatic pain without it being sciatica.
Right.
But I think another misconception is a lot of people come in and they wonder right away, do I need surgery?
Right. And a lot of times, no.
Right. So in most cases, the reason why most people believe about having surgery is because they think that maybe they may have blown a disc, or maybe you got told that you've blown a disc.
Right.
And so a lot of times people say, well, do I need surgery? Maybe I have a blown disc.
Right.
So why is that a big misconception for low back pain?
We were talking about this and it slipped my brain.
Yeah, no.
A lot, because maybe the disc isn't truly blown, or...
Well, I think most people, and you can confer with me, but most people, I believe, when they come in, when they have that diagnosis, I have a blown disc, they feel like it should be the cause for the pain, when in many cases it's not. Like, there's even a study done with military personnel where they did an MRI, I believe it was, of 100, 300 different personnel, and they found people with disc bulges that weren't having back pain. Right? And then they MRI'd them again later, and guess what?
Some didn't have it.
Some didn't have it anymore, and still no symptoms, and other ones did. So it kind of moved around. So lots of times, bulging discs they spontaneously heal, and they spontaneously occur due to different traumas. But we know an interesting fact about the brain or the spinal cord and bulging discs, because if you have a bulging disc and it pushes into the spinal cord, that doesn't necessarily cause pain.
Right. I don't know what you want me to say.
It causes what?
Oh, pain and numbness.
Yeah.
Sorry, my brain just
Yeah, we
went
get numbness and tingling.
in the lower extremities.
Yeah, in the lower extremities. Sometimes a numb spot, maybe in the tush area or something to that effect. But many times the bulging disc is not the problem.
Right.
We see a lot more people who may have a bulging disc, but really it's a joint that's maybe locked out. It's a muscle that is chronically tight, or it's a tendon or a muscle that has been torn that you wouldn't think about, or it's a different nerve totally altogether that actually perceives pain.
Right. And sometimes that muscle, it could be torn.
Yeah, exactly.
So we find a lot of people that have a torn muscle, and sometimes, give it time, it will heal, but we want it to heal properly.
Well, I guess the second question and the next set question of that is, what is causing the torn muscle? Why did it tear?
Right.
Right. And so maybe another misconception we get a lot of is, why not just use a belt?
Right. And one of those things, a lot of times they don't decrease the ability. I've heard a lot of people saying, I was wearing a belt and I still blew my back out.
Yeah.
I think a lot of people, what happens, for some people it's good for a reminder.
Right.
But for some they think, it's going to stop it from happening, and then they still do the same thing they were doing before.
Well, it's because it's the muscles that are involved, right?
Right.
And so when you're lifting and things, the belt is there, good reminder. It's there for some support. But that's what it is, support. It is not your body, right, being engaged in the actual lifting activity.
Right.
So even in my own case, when I wore a belt early on with my back pain, I kept wondering, isn't this supposed to make it feel better?
Right.
And it didn't, because it was just there for support. Now, many times it can relieve some support issues, but if you use a belt too much,
Become reliable.
yeah, you can be your body may adapt to rely on the belt itself, and now your body's even in less stable condition than it was before.
So, one of the next misconceptions is, what do you do when you have low back pain?
Yeah, so we hear that a lot, right? Oh, well, I just went and did this, and that doesn't work so much.
And it hurt, so I went and took a hot bath.
Right.
And it made it worse.
Right. Or it felt better, but then afterwards it was back to where it was.
Right.
So typically, we know that heat is good for relieving pain, and it's good for a few other things.
Right.
But typically not for low back pain. Typically. It does relieve pain in the moment.
Right.
But getting a good hot bath, yeah, it's going to feel okay for a minute. The muscles are relaxed, but as soon as you get back to it, your body's going to go back to adaptation, go back to the point of, I now need to support myself in this way, and and the pain comes back because of that.
And we find that a lot of people that in those instances where you just hurt your low back, people do run for the heat because that's what they hear.
Right.
But when you have that low back injury, what happens is that inflammation is coming into that area.
That's right.
And that heat is going to increase that inflammation. And I almost had someone come in, they're like, oh man, it was good. I took a hot bath this morning and it was worse.
Yep.
And hasn't gotten better. I'm like, have you tried ice? You're like, no.
Yeah, so there's some reasons,
Right.
especially for ice, especially if it's a sprain or strain, that ice is going to work a little more efficiently in a specific way.
Right.
And don't just go run and throw on ice or jumping in an ice bath or nothing, because that might not work either.
Right.
But there are specific reasons that hot bath is not always the best option, because it can increase the inflammation to the area.
Right.
And not that that's a bad thing, but it may be a more painful thing.
Right.
Yeah. I always hear guys come in and they're like, oh, what if I just stretch? Oh, there's some stretches I can do, Doc. Hey, Doc, you fixed me because there's some stretches I can do. Well, I answer this quite a bit because in my own experience, having had low back pain, and knowing that it's there, and knowing that it is actually a neck bone problem, and that is just adapting to that, I know that there takes time to become stable.
Right.
It takes time for the body to heal, for the muscles to heal, for the body to become stable again. And that's for every joint. That's for every muscle. we like to think as humans that if it feels good, I must be good to go.
Right.
And that's not always true, is it?
No.
So lots of guys will say, can I just stretch this now and stretch it out? I'm like, okay, but you run the risk of re-injuring, more injury, until it is actually stable.
Right.
Yeah.
And the other one is, when is it good to get a massage afterwards too?
Right. Right.
And there's a lot of people who they think, oh man, I hurt my low back, I'm gonna go run and get a massage.
Yeah.
And I'm not saying the massage is bad. But
No, we got lots of great masseuses even in this area who do a great job at understanding what to massage and what not to massage.
Right.
Yeah.
But if it's not a low back problem, it's a top neck bone problem, the massage is gonna be it's gonna be a Band-Aid.
Yeah, it's a temporary relief. But that's the same, so it's kind of similar to the hot, right? It's kind of jumping in the tub. It's a temporary relief. And that's cool, but you may run the risk of further injury. And we're not saying that's because of massage, but you may run the risk of further injury because of how the body adapts.
Right. And there comes a time after things are settling, getting more stable, where stretching will be advantageous to do.
Yeah.
Also going and doing
Massage.
Yeah. Also doing exercises.
Yeah.
I always love the bodybuilders who come in with low back injury and go like, you need
take 6 weeks off, and they're like, no.
And then finally you're like, okay, you can do it, just do it with really light weight. And then they're like, it's amazing, they come back, you're like, yeah, I was really itchy for a long time wanting to go work out, but you were right.
Yeah, no, when they follow, it's amazing what happens when you follow the directions, right?
Right.
Yeah. We get a lot of too that's like, my back pain came out of nowhere.
It was sneaky.
Yeah.
It was hiding behind, your kids, you're walking through your house.
It surprised me. So one of the things that happens when you have injury is that sometimes the swelling process takes time. Or you may not feel it until the healing process begins.
Right.
And lots of times that's when we say, and we hear this a lot, well, I just woke up with it. When actuality is, when you were sleeping, you were healing and you were unconscious to the pain.
Right.
When you woke up and you're like, oh, and now oh my gosh, what's going on? That's because the healing process started. There's some inflammation there, which is good. You want some inflammation, but you don't want it to necessarily override anything.
Right. And a lot of times I always talk to the truck drivers who sit for long periods of time, because those are the ones who usually get the injury because they jump out of the truck and after sitting for hours and they just bending or twisting out of the truck or jumping out of the truck and boom, that's when it happens.
Right.
But it wasn't so much that may have been the cause of that instant pain, but those muscles were
not
activated.
Yeah,
properly.
they're not ready to engage.
So I always tell people, I'm like, after you've been sitting, even in a long car ride, always get up, make sure you tighten all those muscles, get them acting properly activated. That's the right word.
Yeah, don't just jump out and start pulling all stuff out of the car.
Yeah, take a break.
Yeah.
Walk around a little bit.
Walk around a minute. And in fact, I think even the advice for truck drivers is to wait, I think it's 20 minutes before taking out the hoses and everything and doing that. I'm pretty sure it's up to 20 minutes before you do anything. Of course, maybe any truck driver might call you crazy because they got to get to the next job. But
right.
But I think that's the recommendation, is to wait 10, 15, 20 minutes before even doing anything after you've been driving for more than, I think it's an hour and a half.
Right.
So if that's their recommendation, so much more for us too.
But the most important is getting those muscles reactivated after being lazy and sitting for a while, and always using good and safe lifting techniques, avoid any twisting with heavy weights and stuff like that.
So our last misconception kind of takes us back around to, what is, back pain? Where does it start? Because a lot of people believe that back pain is back pain. That's where it started. Well, I have back pain. It must be a back problem.
Right.
This is an issue. We have with those who just allopathically treat back pain, because lots of times, even in my own care, it wasn't a back problem.
Right.
It wasn't until I got to chiropractic school and figured out it was a neck problem, and all the posture muscles were adapting to that.
Right.
And we got that corrected, and then finally, 6 months after working with that, I got my first day of no pain.
Right.
Now, I got good results, right? I had days of, not so sore, good days moving, but I actually had a day of no pain, and that was good for me.
Right.
And now 8 years later, after starting that process, I live 98% pain-free. I'm doing things I haven't done in forever. There have even been moments when I'm like, oh, this is it, this is the time, and it didn't. The muscles went, nope, we got this, dude, we got you.
So it didn't sneak out of nowhere.
We're supporting your back. We got your back. Yeah, no, it didn't sneak up on me or nothing. But we get that a lot where people feel like the back pain is the problem, and they're always surprised. It's your neck that's the problem, right? And because we're specialists of the neck, we find that a lot.
Right.
But we also find other areas too that people don't realize. Every once in a while, something comes up and it's your knee's the problem, right? Or your pinky finger. I don't know. I'm just saying.
Your left phalange.
Your left phalange is the issue. So don't be surprised if you have a back problem that it really is the back, because it might have been stemming from something else. Maybe it's postural derived, or maybe it was a neck problem. Maybe it was that knee. That your body's been trying to compensate for years and years, and those muscles have been working 400 or 500 times harder than they really should be. And finally, it was that event that took you over the edge.
Yeah. And sometimes it's people think it's common to live in pain, and a lot of times those muscles finally say, okay, if you're not listening to me, I'm just gonna be quiet for a while. And then you start, and I think of it too, once you get things healing, the body's like, oh yeah, remember, I'm right here.
Yeah.
Fix me too.
Right.
So,
yeah.
And I always tell people, you do have a low back issue, but the problem is that top neck bone, and we want to get that into place.
Right.
Sometimes we may not have to adjust, even touch the low back.
Right.
Sometimes we need to, especially, a lot of the construction workers that we see, their neck's holding, but they're having some low back pain because they may have done something a little silly at work.
A little spray and strain there on top of whatever's going on.
Right.
And the body heals up. What's great is when the neck's in place, it's amazing how much faster the body heals.
Right.
And how much more efficiently it heals, making it a lasting healing process.
And it's sometimes easier to adjust other areas of the spine too when it's needed.
Right. So what are some recommendations we can give to those who are experiencing low back pain? I think the first and foremost is get checked by a good chiropractor.
Right.
Get checked by somebody who's going to check everything and not just say, oh yeah, you have a back problem, let's attack that.
Right.
Make sure they're checking everything and creating a plan that's going to show you, yes, you're having a problem here, but this is the overlaying problem. Many people are in layers, those types of things. But there are some other recommendations for avoiding low back pain.
Exercise.
Right? Regular exercise is a good one.
The new smoking.
The new smoking.
What's worse than smoking?
What's worse than smoking?
Well, not smoking, but sitting is almost up there with smoking now.
Yeah. Well, I actually just read a study that said that the one thing that's almost worse than smoking is not exercising.
Right.
And then 30 minutes a day is their recommendation for that. So keep the muscles working. Have a good flexibility program. Whether it's yoga or swimming, I recommend swimming a lot. Swimming, running, whatever it is. So your body can maintain the health of the muscles that are working, because what pulls on bones?
Muscles.
Yeah, muscles. And what controls muscles?
The brain.
Yeah, and through the nervous system, you got to have it all healthy and strong, or else it doesn't work as well together.
And we're not saying pick up smoking and exercise, but we're
versus exercise.
Right.
Yeah. Make sure you exercise. No, definitely don't smoke.
Maintain a healthy body weight as well.
Yep. And we know there are bigger people and smaller people, but your body weight is your body weight. Maintain it healthily. So.
Pay attention to posture.
Yeah, because we do. Yeah, and that's a first sign that something's been going wrong, especially in the low back. So if something in the low back is being affected, it can show up in your posture really simply.
Right. Not last, but good lifting techniques.
Yeah, make sure you're lifting properly.
And we cannot express enough to see a chiropractor.
Yeah, find a chiropractor. We recommend an upper cervical chiropractor that's going to take all the factors into consideration, checking the neck, especially for posture, especially for the opportunity to make sure that is working, because if that's working, you are healing properly. And that's the first and foremost thing that we get to be looking for,
Right.
is whether or not I'm healing properly. Feeling good is great.
Feeling good is great.
But healing good is better.
It is better.
Yeah.
And feeling, once you're healing and things are healed, guess what?
Yeah, the feelings of betterness will come along. That's
Right.
why I can say now I live 98% pain-free. Whereas 8, 10, 15 years ago, I couldn't have said that. 60, 70%.
Right.
On a good day, maybe 80. But now I live 98% pain-free.
Wonderful.
Yeah, and it's exciting. I'm going to keep saying that because I love it. It just makes me feel so free that I found I figured out what was going on. And it was not a back. I had a back problem, but my neck problem was the overriding problem.
I think it's interesting too in that story. You were going to be a dentist, or you wanted to be a dentist.
Yeah, my first course of action for schooling was I was looking to go to school to become a dentist, which maybe I should have. I don't know, but chiropractic was a great fit, and it taught me a lot about the body, how it works, and it was a great fit for me in the long run.
Right.
Yeah.
Well, that's a little bit about low back and what we can do, what some of the common misconceptions about back pain, and what we can do to avoid back pain. And I think it was a good discussion today.
Yeah, some good things out there. Just maybe a quick shift, because one thing we should mention is surgery with back pain.
Right.
And it's nothing against surgeons who do a great job out there. Thank you very much for stitching us back together. But there is some conceptions about surgery and back pain, and we want to be careful that we're not just stepping in there and maybe even forcing the hand of the surgeon saying, fix me.
Right.
Because the statistic out there that floats out there is 19 out of 20 back surgeries do not succeed. And out of the 1% that do, it is common that 50% of those, even after 6 months of no pain, do revert back to pain. And this is nothing against our fantastic, wonderful surgeons out there who are doing such a great job.
Right.
But many times we find that the body, that wasn't truly the problem.
Right.
And so we want to look for making sure that our bodies are healing properly rather than just trying to fix necessarily what maybe is not the problem.
And sometimes it's just, even you may be a candidate for back surgery, but
Right.
just trying getting cut open. Not only do you have to heal from the surgery and the injury that you had, but other problems, other issues that could arise as a result.
Yeah.
That we could talk for hours about, I think.
Well, I think it's just important to note that always look for that other opportunity if you can. Especially with upper cervical chiropractic, we feel like we do a great job. Even in my own care, you may think I'm a unique case. I'm not. I had what's called a bilateral spondylitis. It was a broken spine, as far as we can tell, and it was pain for years. I'm thankful for my primary care physician who said I was too young for surgery and I should try to handle this other ways. Thank you so much for that.
Great.
And I did eventually get it taken care of correctly because I did see other professionals, physical therapists. I did the drug route, and I thought seriously about surgery. But I'm glad that I was able to figure this out and go from there.
Great. So if you have any questions, please submit those and send us messages. Let us know if you're looking for a chiropractor that does upper cervical. You can look at the Blair Chiropractic website. Even type into Google upper cervical chiropractor.
Yeah.
upcspine.com.
Is a great resource.
Contact us and we will find someone in your area.
Our office number is 435-6880-444. Or you can connect us online at simplyhealthchiropractic.com. There's a contact form at the bottom of the front page there. So if you have questions or like to make a discussion, just go ahead and send us a quick message and let us know what you're thinking.
Right. And what are we talking about next week?
Next week, I think we're talking about actually coming back around to the neck pain, if I remember right.
Okay.
So we have neck pain scheduled for next week. We talked about back pain. We've talked about headaches and migraines. We get to talk about actual neck pain.
Sweet.
Yeah, so what's going on there and what's happening. And maybe we can throw in maybe even some shoulders, because we've done a little bit of neck already, but we'll see what happens.
Right, and get a lot of people with shoulder pain related to the neck.
Right, a lot of that going on.
All right.
Thank you very much for listening in.
And we'll see you next week.
Take care.